Happy Friday, Mobile. I'm Rendi Murphree, epidemiologist and director of disease surveillance at the Mobile County Health Department. We are having a rare dress down day, trying to promote COVID testing. If you want to get a COVID test, call us at 251-690-8889. So I think we'll skip over maybe the world, US and Alabama case numbers today, except to say that they are really, really big. These are really high numbers. So we are still in the throes of a pandemic for COVID-19, and it is getting worse in southern and western states. In the Mobile County Health Department report that was provided today by the SSI group, our partner, we're reporting 5,767 cases. 202 cases were added yesterday. This is right at our highest peak, our highest number of cases on any given day that we have seen. Last Friday, I reported that we had added 203, and that was adjusted down to 201. So if the 202 number holds, that is the largest number of cases added in a single day in Mobile County residents. So please, please understand that the outbreak now is the worst it has been since it began in March in Mobile County, and we are not out of the woods, not even by a long shot. We have a lot of community transmission going on out there, and we need your help to slow the transmission throughout the community so that we don't overwhelm our healthcare system and not have enough hospital beds, ICU beds, ventilators to treat all of the people with COVID-19 that are at risk of severe complications and deaths, being people with underlying conditions or who are over the age of 65. So remember, it's mostly being driven right now by the younger age groups, 18 to 50 or so. Infection in that age group is often mild or asymptomatic, and these are the people who don't even realize that they are spreading COVID-19 in the community because they have no symptoms, and if they're not wearing a face covering to stop the respiratory droplets from being exhaled or spoken or sneezed or coughed out, then they can be exposing other individuals without even knowing it. Just to remind you, the amended Safer at Home order went into effect yesterday at 5 p.m. that requires face covering when you're in public and in close contact with other people. Specifically, the order says to wear a mask when you're within 6 feet of a person from another household in any of the following places: an indoor space open to the public, a vehicle operated by a transportation service, and outdoor public space where 10 or more people are gathered. So again, that is for the entire state of Alabama, went into effect yesterday at 5 o'clock. This applies to Alabama residents and people who are visiting this great state of Alabama. I've been asked a few questions about the new guidelines for quarantine and isolation that ADPH put out this week on the 13th. For COVID cases, if you are a COVID case, PCR positive without symptoms or PCR positive with symptoms, you must stay at home for at least 10 days. At least 10 days. If you're symptomatic, the last 3 of those days have to be without any symptoms. And if you have no symptoms, after those 10 days, you need to be wearing a mask for a few days to make sure that you're not spreading virus anymore. For people who are close contacts to a COVID case, this is someone who has been within 6 feet for 15 minutes or more, with or without wearing a mask. A mask doesn't keep you out of quarantine. If you are within 6 feet for 15 minutes or longer of someone who is COVID positive, you must stay at home for 14 days. There is no negative testing that can get you out of quarantine. There is no, but I'm an essential worker that can get you out of quarantine. 14 days for everyone who's been exposed to a COVID case. The CDC and ADPH are sort of backing off any preference for lifting or discontinuing isolation and quarantine for people. They're kind of leaning toward using the time-based method or the symptom-based method, and not preferring or recommending the test-based method where you would have to have 2 negative tests, because testing right now is overwhelmed, overburdened, supplies are in critically low levels, and we are not making it better by recommending that everybody get 2 negative tests. After your 14-day quarantine, as long as you are no longer, as you don't develop symptoms during those 14 days, then you can discontinue isolation. You don't have to have 2 negative tests. There are some exceptions which are noted mostly for healthcare personnel in congregate settings that are having outbreaks. Okay, over to a couple of questions. Someone asked yesterday, and I was not able to answer because I did not know about this, about a report that there were unapproved sanitation wipes that were caught by Customs and Border Protection in Mobile Bay. And so let me just give you, this is straight from the CBP, Customs and Border Protection. It was in the news. This was released on the 15th. CBP Mobile intercepts 120,000 unapproved sanitary wipes. So let's see. Sorry, did you have some comment? Sorry. CBP officers discovered a container of 843 boxes containing 20,000 bottles of disinfectant wipes that bore no approved marking from neither the U.S. Food and Drug Administration nor the Environmental Protection Agency. And after further examination, the shipment was refused entry based on false or misleading labeling and failure to report to the FDA. So good job out there, our federal partners helping to protect our ports. We appreciate you and the work that you do on the front lines. Thought I might just mention again that there has been an FDA report of hand sanitizers that contain methanol and maybe another toxic substance that is a health hazard. These are from a company out of Mexico called ESK Biochem. Again, check the label for any hand sanitizer that is made by ESK Biochem and don't use it. An interesting statement which might make it easy for you to determine if you should use it or not. FDA encourages consumers not to buy brands of hand sanitizer that say FDA approved, because FDA doesn't approve hand sanitizers. So that might be a tip that you may be looking at a rogue product. But there are a list of products produced by ESK Biochem and then a couple other companies. So check the FDA recall website for the other companies that are on that list of hand sanitizers containing potentially harmful products. Right. I believe the rest of the questions that I have are from Facebook. So this might take a little bit. I will try to get through as many of these as I can, but I may just have to stop at some point when everyone is sort of bored of hearing me answer questions. Someone was asking, if a person tests negative but has obvious COVID symptoms, should they quarantine for 14 days? Yes. Regardless of testing, if you have COVID symptoms, stay at home for 14 days. Well, actually, if you have COVID symptoms and exposure to someone with COVID, you need to stay at home for 10 days, right? So the 14-day applies to someone who is exposed. If you are exposed to someone with COVID, you stay at home for 14 days, and that's based on the incubation period of the virus. You should get sick between 2 and 14 days. So if you made it through 14 days after exposure, you can discontinue quarantine and move about your way. If you have a PCR positive COVID, or if you have exposure and symptoms of COVID, then you should stay home for 10 days and discontinue isolation no sooner than 10 days, but the last 3 days have to be symptom-free. I know it's a little tricky. So if you are having any trouble figuring it out, talk to your healthcare provider or give us a ring and we will try to help you. Golly, someone asking how many complaints we've had, and I forgot to get that number before we came in there. Will you help me remember to have that on Monday? Sorry. We do have someone that is collecting and compiling the number of complaints that we've had every day. It's dozens, I can tell you that, but I don't know how many there have been, so we'll try that again on Monday. Apologize for that. Here's a question. Can you test negative but catch it on the way home? Yes. So how does a negative test do any good unless you're sick and they need to treat you? So yes, a single negative test does not mean you don't have COVID for reasons why you stated here. You could get exposed on the way home and you don't have COVID. That's why when we use test-based for discontinuing quarantine and isolation, it has to be at least 2 negative tests more than a day apart. But again, if you are sick and you have exposure, whether you are tested or not, the guidance is the same. Go home. If you're sick, go home for at least 10 days. If you have a positive test, go home for at least 10 days. All right. A question about the evidence around masks making a difference. And someone was saying that they thought CDC had come out to say that masks don't make much of a difference in some cases, but I think on the flip side, there is new literature out there that masks provide an enormous amount of protection. Look for the MMWR report on the hairdressers at a salon that were COVID positive and wore their mask and treated clients for a few days, and something like 150 clients that were seen during those couple days that they were COVID positive but worked while wearing a face covering. They did not catch COVID. So there may be 1 or 2 instances out there where a mask may not help greatly, but there are plenty of examples of where it does. So please wear the mask. What about hospitals not taking a case off the list? So let me tell you, public health surveillance is cumulative throughout the year. We count the number of cases all throughout the year, and then at the beginning of the next year, we usually start counting again. The big exception to that is flu, when we count flu season from September, October through April, May. Well, we count them all year long, but that's how we report the cases, is during a flu season. But traditionally, things like salmonella and syphilis, we count cumulatively throughout the calendar year, and then we start over at the beginning of the year. With regard to the hospital data that they report to AIMS, so if they say we have 100 people hospitalized today for AIMS, they do take people off the list when they're discharged from the hospital. Let's see, if I had COVID already, do I still have to wear a face covering? Yes, you do. Within 6 feet for more than 15 minutes or longer. Why the 15 minutes? That is a CDC recommendation. I do not know the science behind the 15-minute rule, but I'm sure it was driven based on some reports in the literature. I just don't know what those are. But I tend to adhere to the public health recommendations that come from the Centers for Disease Control. I know that they changed a lot based on current science, but from day one, it has been 15 minutes or more cumulative within 6 feet. We call these people 615ers. So if you're a 615er, you're exposed. Let's see, how likely is it to get a false negative after a day or 2 of having symptoms? It's very likely to get a false negative. Oh, after having symptoms. Sorry, let me think about this. So if you are already having symptoms, the chance of a false negative is low. Because if you have symptoms, you have enough virus in your body to cause those symptoms, and they probably would be picked up by PCR. So false negative if you are symptomatic is not likely to be a false negative. It's more likely that you have some other agent causing your respiratory illness. And you don't have to wait. If you're symptomatic, you can get tested right away. There's no waiting to get tested if you have symptoms. someone on Facebook noticing that it takes so long to get test results back, and it's contributing to the widespread nature of the outbreak. And that is true. It is very difficult in congregate settings to quickly identify, isolate, and control spread in congregate settings when it takes so long to get a test result back. For people who are just getting tested in the community, if there's a reason that you got tested, you should go home and wait for your test result. You shouldn't be just running around the community. If you thought you had COVID and you went to get tested, stay at home till you get your test result, okay? And that'll help us slow the spread in the community. All right, now I think I'm getting to today's questions. I'm going to try to be really quickly about this. If a person has been diagnosed and then they got better, can they catch it again? And would the symptoms be as severe as the first diagnosis? For COVID-19, we're not sure yet. The science and decisions and are still out as to whether a infection will build enough immunity to protect a person from a secondary exposure to the virus. So we don't know if the second case of COVID would be as severe as the first or more severe than the first. And the 1918 pandemic, influenza, that was why the second peak was very much worse than the first, because the re-exposure, the reinfection wreaked havoc on a person's immune system and respiratory system, and it caused them to be more ill than the first time. Someone asking about the use of taking aspirin to help improve oxygen uptake in the blood supply. I've not read anything about that. I don't know if that is true, but certainly there are a lot of people out there who have been advised by their healthcare provider to take aspirin to prevent blood clotting and blood clots in the lungs. I have not seen any evidence that improves oxygen uptake if you're infected with COVID. Let's see. So someone asking about the change in the way remdesivir, the life-saving drug for people who are in the ICU, if that is going to create problems. And I believe that there was just going to be maybe a slight delay in orders being filled when the transfer was happening from the state to the feds for filling remdesivir orders. It also means that I will not have visibility anymore on what hospitals are receiving remdesivir. So we talk with our hospitals weekly and we ask them these kinds of questions, but I will no longer be able to supply you with the number of doses or number of vials that the state has shipped to Mobile hospitals. Someone asking about finding more age-specific data. I did put, I think, a little bit more information on age in the weekly report, where I showed the number of cases by week split out by age group, so that you could see the trend of increases in number of cases and what age groups those were in. I'm not able to sort of publish smaller age groups than that because we're following CDC and ADPH guidance, but I might take a look at it and maybe give you something verbally on Monday if I remember. And then the last COVID question comes from someone who was having trouble reconciling the number of COVID cases reported among Mobile residents by the state health department and by the local health department, by us. And the days that this Facebook viewer checked on it, I think it was the 16th and the 17th, so just recently. So these numbers are going to bounce around for a few days. And the numbers quoted here were only off by, 50 or 55, and that's about 1% of our total count. So that does not bother me at all, because that's a very low number, very low margin of error. But part of the reason, and perhaps all of the reason, I have two explanations for you. One is Alabama and Mobile run their reports at different times of the day. And this is likely the major contributor to the difference in numbers, because lab reports are coming in throughout the day. Also, what happens is Sometimes there is a jurisdiction challenge. So maybe the jurisdiction is unassigned and then it gets assigned to Mobile, or the jurisdiction was assigned Baldwin and then we find out that they were Mobile cases. So, or they lived in Mississippi and we need to transfer the case out. So there are legitimate explanations for why those numbers do not match. It's a very small difference and most likely due to the timing and when we run our reports in a real-time system. So lastly, I want to acknowledge that we're in the throes of summer, and I believe the deep sea fishing rodeo is going on this weekend in Dauphin Island. So just want to remind you, when you are out enjoying events and beaches, please wear your face covering to the greatest extent possible. Social distance, keep 6 feet apart from you and others. Stay at home if you're sick. Don't mingle with people outside your immediate household. Cover your cough. Wash your hands. Carry hand sanitizer with you. And particularly for the deep sea fishing rodeo, want to make sure that you participate and you observe safely. We want to keep you safe in the summer, not just from COVID, but also from, boating accidents. So please file a float plan. Let people know where you're going. Take plenty of sunscreen. Take lots of water. You can keep it in the same cooler with the adult beverages, but take and drink lots of water. And then particularly if you're on a small boat or a recreational vehicle, please wear a personal flotation device so that you can enjoy our bayline and our coastlines safely by just keeping an eye on those things. Tell someone where you're going, wear some sunscreen, drink plenty of water, and wear a personal flotation device when you're in a small boat or on a personal recreational vehicle in the water. So with that, I'm going to end today's Facebook. Please have a great weekend. Enjoy our great city and county and state, but please do it safely. Thank you.